Condom is a barrier device that reduces the chance of pregnancy and STDs. When you use a condom and spermicide, it is no more effective against STDs and is more expensive and has a shorter shelf life. It is easy to obtain and is also inexpensive compared to other forms of birth control. A condom is 95% effective.
The rhythm method is when you do not have sex or use a barrier method on the days you are most fertile. Some advantages of a rhythm is that it is cheap and does not have effect on your hormones. You also learn about your menstrual cycle. Although, with the rhythm method, you have to put in time checking your cervical mucus and recording your body temperature. The effectiveness is 25%. A vasectomy is when the vas deferentia is severed and then sealed. It keeps the sperm from entering the penis. Procedure is very simple and effective and safe with no long-term side effects. Some disadvantages is that it doesn't protect from STDs, it is very difficult to reverse, has a painful recovery, and is not always successful. A vasectomy is 100% effective.
Abstinence is another way of birth control. This means that you do not have sex at any time. This is the only sure way to prevent pregnancy and protect against STIs. Method is 100% effective, and the only disadvantage would be that you would not be able to take part in coitus.
The vaginal ring is a thin, flexible ring that releases the hormones progesterone and estrogen. It works by stopping the ovaries from releasing eggs. It also thickens the cervical mucus, which stops the sperm from joining the egg. The advantages is that you don't have to take it daily and it's easy to use. The disadvantages is that it can cause blood clotting after giving birth. You also must be very comfortable with your body to put it in. It is 99.7% effective.
Oral contraception is a pill containing estrogen and progesterone. It stops the release of an egg. It also changes the uterine lining and the cervical muscle, which stops sperm joining to the egg. The pill is easy to obtain and comes in many different types, although you must remember to take it at the same time every day. It is also 97% effective.
The diaphragm is a shallow dome-shaped cup with a flexible rim. It is made of silicone, which is inserted to the vagina and covers the cervix. Some advantages is that it can be used during breastfeeding and has no effect on the women's hormones. Some disadvantages is that it is difficult to insert and may need to be refitted.
Most spermicides that are used with the diaphragm contain nonoxynol 9. Nonoxynol 9 has certain risks. If it is used many times a day or for people at risk for HIV, it may irritate tissue and increase the risk of HIV and other STIs. Tubal ligation is a surgical procedure in which a woman's fallopian tubes are tied, blocked, or cut. This is considered a permanent method of birth control. Although this method is considered 100% effective and a permanent method of birth control, depending on the type of surgery you have, some doctors may recommend you to take another means of birth control for 3 months after you have the procedure done.
An intrauterine device is a small device shaped like a T that goes in your vagina and releases hormone. It is long-lasting and does not have to be taken daily, but it is hard to take out if you want a baby, and it is 95% effective.
An implant rod is a matchstick-sized, flexible rod that is put under the skin in the upper arm. It releases progesterone, keeping the sperm from joining an egg. It is effective for 3 years. An implant rod is 99% effective and can be removed. It also is safe and can be used by breastfeeding mothers, although it requires surgery and can be visible underneath the skin. It's costly and does not protect from STDs.
What factors may influence the selection of a birth control method? The effectiveness, the price, personal preference, and length of usability.
What methods may also protect against sexually transmitted diseases? Condoms, abstinence, and watching a live birth.
Identify and explain 2 ethical issues that could affect the selection of a birth control method. Abstinence. It can be a religious choice. It may be considered wrong to have sex before marriage. Some religions believe that you should not use birth control because it is interfering with God's will.
What health problems may arise as a result of long-term use of contraceptive pills containing estrogen and progesterone?
Increased risk of stroke and heart disease, may change rhythm of your menstrual cycle, increase risk of breast cancer, affect cholesterol levels, and increase your blood pressure.